if not already obvious, I love, love, love my job. I love where I work, and I look forward to going to work every day to take care of our cute little kids with sick hearts just like my own. Hello everybody, welcome to my channel. My name is Marissa with Life After the Fontan. Thank you so much for joining us today. If you're new here, I'm 24 years old, living with complex congenital heart defects, really documenting my life as a single ventricle Fontan. If you're returning, thank you so much for coming back. Please remember to like this video, subscribe to my channel, and turn on that notification bell if you'd like to be one of the first to watch my upcoming videos. In today's video, we're going to be discussing my journey to becoming a nurse, and I call it a journey because it has definitely proved itself to be one multiple times over. So today's video is just going to be tackled a little differently than videos I've done in the past. I would like to address this more as a question and answer video. Now, this is really the second time I'm recording this because in the first one, I did one question and then forgot to formulate questions from there on out. So now I have them written down, and hopefully we will continue with that format throughout the whole video. For those that are unaware, I have been a nurse for almost 2.5 years now. I currently work in a pediatric cardiac intensive care unit, and I am in graduate school to receive my master's degree as a clinical nurse specialist, which is a type of an advanced practice nurse, which we will talk about later on. The first question is, did your CHD make you want to become a nurse? I would have to say 100%. I love the heart. I've loved learning about the heart for as long as I can remember. I, of course, am very used to the medical field. Mom is also a nurse, so I've always been familiar with a schedule for a nurse. She's worked in an emergency department for over 30 years now, so for my entire life. I watched her in action outside of the hospital a few different times when she would help out at a car accident or while on a flight if another passenger was feeling sick, and I used to always think, that's what I want to do. My dad also has a medical background as he was a medic in the Army, so I kind of had to do something in the medical field. I don't think my CHD would allow me to go into the Army, but I am allowed to be a nurse, so there we go. When did I decide I wanted to be a nurse? To be quite honest, I can't remember a time where I wanted to do something else. I, even now, can't even think of a different career that I would find myself in if it weren't for nursing. I wish that my mom were here in this video to describe this because she probably tells it much better than I do. But she has told me before that she knew I was going to become a nurse from a very young age because when I used to play with baby dolls, I wouldn't do the normal dress up or whatever someone normally does with a baby doll. I would give them an echo. I would do an EKG. I'd put in a fake IV. I'd draw some fake labs. I would take their blood pressure. I don't think most kids do that. It was very normal for me because I had all of those things every 6 months at least, if not more often than that. I also used to speak to my classes during Heart Week each February when I was in grade school, like 1st, 2nd, 3rd, 4th grade. And I would read a book to my class about how your heart works. I would show my classmates how to count their pulse by putting their fingers on their wrist. I loved it. So I think that the heart and education really have always been two staples in my life. And I think I wanted to be a nurse forever. How did my congenital heart defect impact my nursing school experience? So for those that are unfamiliar with how nursing school would generally go, you most of the time take many prerequisite classes your first year of school, and then you start having clinical rotations like maternity, psychiatric, pediatric, medical, surgical, community health. So I'd go to different hospitals, I would go out in the community, and I started that my second year in college, and we did that for 5 semesters straight. I had regular classes too. After I underwent my first clinical rotation, I was able to apply to work as a nursing assistant. My nursing assistant experience was really special to me because I applied to work at the same hospital where I once had my 3 open heart surgeries. I didn't think much of it when I first put in my application, and then I met my soon-to-be nurse manager who remembered me from when I was a baby in the hospital recovering from my 3 open heart surgeries. Not only was my nurse manager one of my previous nurses, but I found more and more current employees who had been there when I was a patient each day, it seemed like. During my orientation, I came home one night and my mom and I were looking through a photo album of pictures from my hospital stays, and I said, "Mom, that nurse looks super familiar. I think she was in my orientation today. I think she taught my class." And I brought that picture in the next day and I said, "Hey, was this you? That's you and me. You're helping my dad give me a bottle." And it was. Isn't that wild? It's probably still one of my favorite stories to tell all throughout my nursing career, I have to say. Between my nurse manager and my clinical nurse specialist, it's just so special to me, and something that, while I no longer work there, I will cherish forever. My congenital heart defect did make my nursing school experience a little difficult after being diagnosed with something called T-cell lymphopenia. While I was in nursing school, I had an endoscopy, which is when they put a scope down your esophagus, and that was basically looking for symptoms of liver disease, which they didn't find. However, they found that I had an infection in my esophagus, which isn't common, and from that I had extensive immune testing done. So basically, your heart, my Fontan, creates higher pressures internally in my circulation, in my veins and arteries, and your lymphatic system, which creates and releases T cells in this case, or your immune fighting cells. Your lymphatic system runs right next to your circulatory system, kind of like they're paired almost. And the lymphatic system releases things into the circulatory system when it needs to. Because of my higher pressures from my Fontan, the lymphatic system is not able to release the proper number of T cells needed to fight off infections. This quickly turned into a nightmare, a disaster, honestly. I couldn't take care of certain patients in school. I couldn't work in certain environments in school or as a nursing assistant. These patients included those under isolation precautions. So really, anybody with a contagious illness, such as skin infections like MRSA, respiratory infections like the flu, and now that I work in pediatrics, I would assume they would also have said rhinovirus, RSV, and can you even imagine if COVID were happening at that time? Because of these restrictions, my school excused me from the nursing program. I had just under a year to go. I had already finished about 3 years of my program. I was being advised, literally, to find a new major, to look into new programs, to think of a new life, pretty much. This was challenging. It was hard. And my management team at the hospital where I worked was very understanding of it and made sure I didn't have to care for those patients, but that couldn't be a long-term thing. I was only going to be a nursing assistant for another year. Think about it, if I were to go to an interview to become a nurse and I had to tell the people interviewing me, "Oh, by the way, I can't take care of any of the sick patients, only the ones that won't give me any illnesses." They wouldn't hire me. Somebody else would walk in 5 minutes after me with the same qualifications, without those restrictions, and they would get hired over me, I'm sure. So something had to be done. I saw another physician in a totally different hospital system, actually a children's hospital, and I was 21 at the time, who had seen more cases of T-cell lymphopenia because they see more patients with the Fontan circulation. And she basically said that, sure, I'm at a little bit of a higher risk of catching a few weird skin things actually, but I had no restrictions for work. I could take care of whatever patient I wanted to. I didn't have to worry about not going into an isolation room or not caring for this patient or not doing anything with that one. And it was like a weight had been lifted off of my shoulders. Things got straightened out and I was able to continue and finish my nursing program. And just to put it out there, I have no restrictions related to the T-cell lymphopenia today. Was it hard to find a job as a nurse because of your congenital heart defects? And you know what? Unfortunately, I would have to say yes to that. My first nursing job seemed to be a little delayed. It took me a while to find my position because my cardiologist had advised me that I was not allowed under any circumstances to work night shift, which is a little funny now since I do, but we'll talk about that. I did find a full-time day shift position in adult cardiology. It was a telemetry medical surgical floor. So medical surgical is basically a very, very broad term that covers really any diagnosis. To be totally honest, I was pretty bummed to not have gotten my dream job right out of nursing school. And looking back now, I can say that I really did grow from my experience there. I worked as a preceptor. I trained newer nurses, even though I was still new. I had nurse externs shadowing me for months at a time. I was a charge nurse for about 6 months of my time there. All of those things felt very overwhelming when I was working there, and I still felt very new. But looking back on it now, I gained invaluable experience that I'll take with me forever, for anywhere I go in my nursing career. After working on that unit for 1 year, I left and moved on to finally my dream job that I had been thinking about for years, in a pediatric cardiac ICU. Didn't I just say that I wasn't allowed to work night shifts, and now I do? I did. My cardiologist and I discussed it a lot, and she really kind of changed her mind on it and thought that I would be okay working night shifts. I've been in a good place cardiac-wise. We stopped a few of my medications, which would have made working night shift a little more complicated. I don't really mind it. I honestly was incredibly nervous about switching from day shift to night shift. Right now I work 50% day shift, 50% night shift, and that's what most people do on the unit I work on. I was so scared because I had been told for the prior year that night shift would not be okay for me, that I couldn't do it, that it wouldn't be good for my heart, all of those things. I think my fear of night shift was worse than actually working night shift, to be totally honest. I every now and then will experience increased arrhythmias or heart palpitations such as PVCs or a higher heart rate during or after night shift, but other than that, I really don't have any issues with it. So again, I accepted my dream job in a pediatric cardiac intensive care unit. However, we really see patients of all ages. The majority of our patients are younger. There will be the occasional adult there who, like myself, I just had a cardiac cath done at the same hospital where I now work. And while I'm not really seen at that hospital, my cardiologist is next door and felt it was better for me to have my cardiac cath at the children's hospital because they're more familiar with congenital heart defects. We'll talk a little bit about that more later on. So most of our patients on any given day are either waiting for or recovering from some form of an open heart surgery. Not all patients there end up having open heart surgery, but I would say the vast majority do. There are many, many patients there that have similar anatomies or identical diagnoses to my own. From the very moment I accepted that job until present day, I think the new, most common question I get asked is it difficult for me to work in a unit where there are a lot of sick patients with the same diagnoses as me? I think that's a pretty loaded question, and I can answer that from a few different perspectives. So to begin, I don't think it's difficult for me seeing patients with similar diagnoses as myself undergoing complications and maybe possibly facing negative outcomes, because I can't go back in time. I can't travel back to when I was 3 days old having my BT shunt, 8 months old having my Hemi Fontan, or even 22 months old having my Fontan completion. I've made it through that stage of my life, and I've survived and thrived up until now when I'm 24. I definitely don't really think that it makes it harder for me to work in the pediatric cardiac ICU because of my CHD. If anything, I think it makes it a little easier. Not to say that my job is easy, but I think I can understand and relate to my patients and their family members on a level that many others can't. So like I mentioned, a lot of our patients are much, much younger than myself, basically newborn or younger than the age of 1, really. And I oftentimes am taking care of my patients, and I'll be changing their diaper or feeding them or doing whatever I need to do. And they may have a similar heart as mine, and I look at them and I think, hey, you're just like me. You're going to have a few surgeries. You're going to have a lifetime of cardiology appointments, echoes, EKGs, everything. But you'll be all right. I got through it, and you can too. And I think about it all the time at work when I see these patients, and I wonder sometimes, will I know them in the future, in 20 years from now, when who even knows if Facebook will be around, but if it is, will they be in the same support groups that I'm in for congenital heart defects? Will they be at the same advocacy events that I go to for congenital heart defects? It's really something to think about. I absolutely love to communicate and interact with the patient's family members, most specifically the parents, I would say. They're in the hospital with their newborn or young or school-aged child who is laying in bed, recovering from or waiting for their open heart surgery, and that's really all they can envision. The only thing they can think about at that time is their sick baby that's laying in their bed. I love to offer hope to these parents. I love to show that their life is more than just their diagnosis. Their life is more than just their CHD. They're more than just that child or that patient that's laying in the crib, the isolette, the bed after their open heart surgery. Another question that a lot of people ask me is, do I tell all of my patients' family members about my congenital heart defect? And the answer there would actually be no. I don't tell every single family member that I interact with about my CHD, first and most importantly because not everyone needs to or wants to know about it. With that being said, if somebody were to approach me and ask about my scar, I am always more than happy to share anything that they'd be interested in hearing. I think honestly my favorite part of my job is sharing my story with family members, and also, like I said, bringing hope. A lot of times they'll ask me if I can remember any of my experiences from my surgeries, and I definitely have no memory of that. But some memories that I can think back to, I think they have allowed me to be a better nurse and to be an asset in the cardiac ICU. For example, I was hospitalized when I was 5 with pneumonia, right around Easter. And there was a nurse named Bob, true story, who used to paint pictures of Easter eggs with me. Now, we may have just painted one picture, or it could have been 500 pictures, but I'm 24 now, and that hospitalization was 19 years ago, and I remember that part. So down the line, I want to be the memory that some former patient has when they think back to, oh, remember when I was 5 or 6 or whatever age and in the hospital for whatever, and there was that nurse Marissa, and she used to paint my nails, or there was that nurse who used to watch TV with me or play this game with me. What am I going to school for right now? So I am currently in graduate school to obtain my master's degree in nursing as a clinical nurse specialist, which is a form of an advanced practice nurse. I am interested in working in transitional congenital heart disease care, which basically means I would like to work with the patients who are at the age where they should no longer be at the children's hospital or with a pediatric cardiologist. Instead, they should be seen by an adult congenital heart disease specialist. Now, adult congenital heart disease specialists it's still a very small subspecialty. Currently, there are now more adults living with congenital heart defects than there are children, but that's really only because of recent medical advancements over the past few decades to allow us to live longer into adulthood. And because of that, this role was never really a necessity back then because patients could continue seeing their pediatric cardiologist. Now, however, we're seeing more and more adult CHD patients. So what I hope to do is serve as really an educator and a nurse liaison or transitional navigator, coordinator, or any of those things to assist in the transition from pediatric to adult care. I really just want to make a difference in the congenital heart defect community and make it easier for patients to continue receiving follow-up care at an appropriate center without any unexpected gaps in care. I actually completed a whole project on this topic for school, and I also did present it with a hospital in Houston. I have that video put into a playlist on my YouTube channel if anyone is interested in watching it. And also, if you'd be interested in learning more about my project, I'd be more than happy to create a whole video talking about it. Please comment down below to let me know, though. I'm not going to record that whole project if nobody is interested. So lastly, would I have any tips or suggestions for other CHDers, whether Fontan or not, interested in becoming a nurse? For starters, I would recommend talking with your cardiology team prior to committing to a nursing program to make sure they feel that the strenuous and long-hour shifts of nursing is appropriate for you. I would also, with that, keep in mind that there are so many different opportunities in nursing, whether you want to work in a hospital, in a doctor's office, in a totally different setting, in home care, somewhere in the community, even in an office for insurance things and things that I don't know enough about to really be talking about. Because of my CHD, I really do try to limit myself to exposures to illnesses that I don't necessarily need to be exposed to. For example, think of how many patients come through emergency department per day with some contagious illness undiagnosed until they're seen by a doctor, have labs drawn, or have viral panels sent down to the lab. I mean, think about it. How many times have you, your child, your friend, anyone gone to the doctor for a cold? Those people that are taking care of you, they're not wearing masks, or at least they weren't before COVID. And they're putting themselves at risk every day. It's just not a situation that I think would be safe for myself to work in. I think the elephant in the room here is COVID-19 and this pandemic and how has it impacted myself as a nurse with congenital heart defects. However, in the essence of time, and because I have much more to share about that, I think maybe my next video will be related to COVID-19 and how it's impacted myself as a CHDer. My last bit of advice is to follow your heart, literally. Don't give up. Continue to advocate for yourself. Follow your heart. If nursing is your dream, you can make it work somehow. The journey there may be a little more challenging than for a different career or for somebody without CHD, but I promise it will be so worth it. If not already obvious, I love love my job. I love where I work, and I look forward to going to work every day to take care of our cute little kids with sick hearts just like my own. If you have any further questions related to my nursing career and my CHD, please comment down below, whether it be on YouTube, on Facebook, whatever you're watching this on, please do. Again, let me know if you'd be interested in hearing more about my project that I completed on transitional CHD care. And keep your eyes peeled for my next video, which I believe will be about COVID-19 and how it has impacted myself as a nurse and a Fontaner.